post we're going to be talking about gluten sensitivity and what are called cross reactions to gluten. And what that means is that you can be gluten-free, be eating other foods that can cross-react with gluten and still have some bad stuff going on in your body. The reason being is that gluten and other foods can react together. So for instance, it's like a lock and key relationship. If I can try to explain what an antigen-antibody reaction is. So if you eat, for instance, gluten, and it's supposed to react with the antibody to gluten, whenever they connect, there's going to be an immune reaction in the body. There's going to be inflammation that is produced. There's going to be immune reactions causing all sorts of issues in your body that we're not going to get into now. But just know if this gluten antibody has a certain shape, there are other foods that actually can cross-react with gluten. Now, the most common foods that cross-react are casein, which is dairy. And then you could have corn, and you could have soy. So there are foods that can actually, when in the presence of these foods and there are gluten antibodies present, they can react and cause a gluten sensitivity. So when you're first going off gluten, you need to recognize that there can be other foods that can also cause the gluten reaction. So that's why only 50% of the people that have celiac disease, which is an autoimmune disease against gluten, that's why only 50% of them resolve on a gluten-free diet. It could be due to the fact that they have other cross reactions. There could be other reasons why also, because yes, a person is eliminating an offending food, a food that they're sensitive to, but they haven't repaired their GI system. And you can find other posts that I've done, other videos on what is called leaky gut syndrome or intestinal permeability. Just do a search on YouTube or on Google for that with my name, and you might find some other videos that I've talked about that whole concept. I'm not going to be talking about that in this video. But just know that other foods have a similar shape, and then when they're present in the presence of the antibody to gluten, they can trigger it. Now, casein is dairy, and that includes any mammalian dairy products. So it could be sheep or goat or cow. It does not matter. If you have a sensitivity to casein, this has nothing to do with lactose intolerance. A lot of my patients come in, well, I've been told I'm not lactose intolerant. That's not what we're talking about here. You can be casein intolerant and not be lactose intolerant. And then the other two are corn and soy. So if you look at it, look at all what gluten-free foods are made from. If you look at gluten-free pastas or gluten-free breads or gluten-free crackers, what do they have in there? Corn and soy. They have other dairy products. So people continue to eat that stuff, and that's why they can continue to feel horrible. So just keep that in mind. These are what are called cross reactions. It's a very common thing to have, that you could be still feeling not too good getting rid of gluten is because of this situation. So I hope this information was good. I hope you enjoyed it. You need to find a doctor who understands cross reactions. If you're ever going to feel better again, you need to find a doctor who understands this concept. And I thank you for watching, and make it a great day.